You're tuned into Recovery TV, the voice of hope, with your host, John J. Tassoni Jr. Discussions and information on addiction and mental health issues. Here's your host, John J. Tassoni Jr., with today's guest.
Welcome to another edition of Recovery TV, and I'm your host, John Tassoni. The Lock Zone. Get it? You all right? Has plenty of it. Put it in your purse, put it in your car, take it out at night, bring it in the house. It saves lives. We're losing too many people. It saves lives. My guest today is Dr. Philip Chan from the Department of Health. Welcome, Doctor, and thank you for joining us today.
Thank you so much for having me. Pleasure to be here.
So let's give my viewers an overview of Department of Health and what your actual job is.
Yeah, so I serve as actually a consultant for the health department. I know it seemed like I was there all the time during the pandemic, but my role has traditionally been as a consultant. My expertise has historically been HIV, STIs, Hep C, and now substance use. I'm involved in the efforts, as you well know.
Yeah. It's hard. It's hard. We're losing a lot of young people, a lot of people daily. I'm sometimes I'm lost for words. Me, lost for words about why young people try different pills, different ways to make themselves feel good because of issues that they're having, whether it be at home, work, or whatever. Any sort of information or suggestions that you can give to people to say, wait, stop. Just stop for a second. Take a deep breath. Maybe you should try this. Maybe you should try that. Any thoughts on that?
Well, this is something I've thought a lot about. I'm a father of a 17 and a 13-year-old, and, I think addiction issues have touched all of us. We all know someone that's been addicted to various things in our life, and including me, including members of my family. And I think a lot of people can relate to that. And I don't know the right answer. I'm not sure the best answer. I mean, I have talked to my kids personally about the dangers of addiction and just being aware. As to why people do it, youth is wasted on the young, right? I think, especially when folks are younger. And I'm not sure I'm the best person to comment on this. I turned 47 this year.
No, it's okay. I'm 66. So
yeah, well, we all did dumb stuff while we were young, right? And I think, there's a sense of being invincible and, having fun. And I think peer pressure is a big part of it.
Right.
And I take responsibility, too, as a primary care doc now. I think the physicians, the providers in the medical field also bear some responsibility in terms of prescribing practices for so many years. Right. And prescribing some of these, when they weren't necessarily always indicated.
You know what really got me? When I first got into the field and I was working with Phoenix House, and I was going out to visit primary care docs and say, hey, maybe you should put these flyers out on your thing. Oh, we don't have any of those type of people. So that kind of got me thinking, like, are you kidding me? You don't realize that some of your patients could be addicted to whether it be opioids or alcohol or whatever. So I think there's a learning curve. I mean, especially I know like at Brown now that they have the docs, the new docs, or they're going to be docs, go to a class of addiction and other things like that. But before, when they thought about that, there was nothing there. There was nothing there. Any comment on that?
Yeah, so I'm also part of the Department of Medicine at Brown.
I knew that.
Brown Physicians, and I practice at Open Door Health, which is an LGBTQ-focused health center in Providence, Rhode Island. And I've always been of a strong belief that in order to fully address the opioid epidemic is that we need to have primary care providers, physicians, nurses, the entire sector really screening for substance use,
right.
And then being able to offer treatment as well. And I think we have to get our primary care community on board because they're our first line health folks, and they need to know how to screen. And obviously, even if they don't know themselves how to treat, for example, with buprenorphine, at least being aware of how to refer people to the appropriate resources.
I know that the changes when you go in to see your primary care doctor, the questions are more involved now. Do you ever think of hurting yourself? Are you taking any sort of medication that we should be aware of that's not prescribed by you? Do you smoke marijuana? You know, the questions are there now, so we should be doing a better job referring out, getting the people help that they need. I mean, I'm not a big proponent of legalization of marijuana right out of the box. I was against it for many, many years. It seems to be creeping up now. Creeping up to the point where you stop at a red light and you can smell it. You go to a ball field, you can smell it. It's taking on a life of its own. Personally, I think it was the worst idea ever for the state to legalize, because there's more problems than there are solutions. You know, you look at your tax bill and your insurance bill. You know, your insurances are going up. They're not going up because the companies want to go up. It's because more people get in accidents, and there's no way to tell if you're high or not high, except for the police officers have to go through the recognition. But there's nothing solid like there is for drinking alcohol. There's nothing solid.
Well, I'll stay out of the politics of this.
Yep.
I think we know from the clinical behavioral standpoint a couple things. The first is that smoking, tobacco, is really the #1 cause of so many health illnesses. So I spend a lot of my time in primary care practice for folks that smoke, just trying to offer options to stop smoking. From a medical clinical standpoint, in my patients that maybe smoke a joint once a day, once a week, from a purely clinical standpoint, I think that that's relatively benign. But we also know, I think the big news from the past year or two, that the World Health Organization has said now that no amount of alcohol is really healthy. I think we just, as a population as well, also have to think about that. And we see a lot of repercussions, too, of alcohol and health.
Yeah, I was just talking to a couple of my residential folks a couple of days ago. It was actually last week. And now alcohol is surpassing opioid use. And the issue of females using alcohol now has risen to a point where it's concerning. It's really concerning. And what does that do to the overall healthcare system, where we have so many people addicted to either opioids, alcohol, mental health issues? I mean, it's going through the roof.
And I think we, rightly so, obviously spend so much attention talking about opioids and fatal overdoses, and I think that attention is certainly due. But I think one of the under-recognized epidemics that we have, not just in our state, but across our country, is alcohol use. I mean, everyone drinks, right? I drink, everyone drinks. And I think at some point, for a number of people, it does cross that line to be more hazardous to your health and have health outcomes. So I think that we as a society need to do a better job about looking at risky and hazardous alcohol use, and at least screening for it and having that conversation.
Right, and I think also, as far as parents go, they need to lock the alcohol, because I just had something in my office the other day, a call of 2 6th graders with alcohol poisoning. Now you go back and you think, I mean, I have a grandson who's 10. He's in the 5th grade, 6th grade. Alcohol poisoning? Wow.
It's young.
Too young. And we need to get those people help. We need to get them education. Parents always say, well, I'm too busy to go and listen to Dr. Phil. I'm too busy to go listen to John Tassoni when they speak about substance use and mental health. No, you're not. You need to go there and you need to listen. Not everybody knows, but everybody can take a second to learn. We're going to take a break. We'll be right back after these messages with Dr. Chang from the Department of Health.
And now, back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Dr. Philip Chan is in the house, and Dr. Chan works for the Department of Health, and he's got a long list of jobs. So welcome, Doctor, and thank you for taking the time to come on the show today. I want to talk a little bit about harm reduction. A lot of people don't get it because they say, oh, you're giving drug addicts drugs. You're only making it worse. Tell us about that.
Yeah, so it's a great question, and I understand where some of these folks are coming from. When I think about harm reduction, it's really meeting people where they're at. Addiction really is a chronic disease. We know that taking some of these highly addictive substances really changes the chemistry of your brain. So, for example, I've taken Percocet once in my life, had surgery on my ankle, was prescribed by a doctor, and I hated it. I got nauseous and threw up and never took another dose in my life. But I'm reminded that some of my patients and some of these folks can take a Percocet, a Vicodin, once, and just it changes the chemistry in your brain and you become addicted to it. So for me, when I think about this, these matters of addiction, it's really meeting people where they're at, trying to do the best we can to help them, and hopefully eventually, get them into recovery and living a more healthier life.
Yeah, I think one of the things too my viewers need to know, when you go into this new harm reduction, the only one in the country right now in the United States, they have them in Canada and other places. Take me through the door. Take me through the door. Tell my viewers what happens to John Tassone when he goes through the door.
So I think this is an exciting thing. This is evidence-based. I think that's one thing I want to lead with. And I've been to some of these sites in Canada. So overdose prevention centers, safe injection sites, are places where people can come in and safely inject their own drugs. And it sounds controversial when you first think about it. However, there's good evidence that when you do this, is that you keep people from dying. And that's one of our biggest priorities, right? So we're still seeing more than one death a day due to fatal overdoses. So we got to get a handle on people dying from these. So the first thing is that these sites, basically you walk in through the door and there's chairs where you can sit. And there's staff that will basically observe, clinical staff and other community staff that will actually watch around the room and make sure that no one's overdosing. If someone goes unconscious, instead of potentially a lot of times dying because there's no one around to help, is that there's staff there right now who can actually come along and administer naloxone and reverse that overdose and save lives. And at the same time, too, I'll mention, is that these organizations, these sites are being set up so that there's other services that are being offered, so that when people are ready to enter recovery or be treated for various other health conditions, is that there'll be the support at these places all in one place where people can get help.
Where do they get the drugs? Do they bring them into this facility, or is it supplied by the facility?
They do. So they will be a person's drugs, so drugs will not be provided. I will say, though, I have seen some models from Canada specifically where they also have a safer supply approach, where some organizations, not in the U.S., not here in Rhode Island, but in Canada, where they will actually give people pharmaceutical-grade drugs where they know the exact potency and they know that it does not contain fentanyl, which, as we know, is the number one cause of a lot of these overdoses.
Yep. Now, is every drug that's brought into the facility tested?
It's up to the discretion of the person and the organization. There are fentanyl test strips and fentanyl testing supplies there, so definitely available to everyone that walks through the door.
Do you think someday that we would have vans or buses that would travel to different areas? I know this is a pilot program, a 6-month pilot program, but we have places like Woonsocket. Over the past month and a half, we've had numerous alerts about people overdosing. Do you think someday we would have some sort of mobile crisis van that goes around?
Well, in my perfect world, we would have a safe injection site in Woonsocket where people could go to.
Right.
So I think the vision would be, if this works in Providence, is to open it up to other cities and towns that maybe experience higher levels of overdoses.
Yeah. What are you hearing now? I know this site has only been open for a few weeks. Are you hearing good results so far?
So they had a ribbon cutting ceremony. It hasn't seen people quite yet.
Okay.
It's still in the process of finishing up construction. So we do anticipate in the new year that it will open and start serving the community.
What is your outlook as a primary care doc? They threw you right in the fire here with COVID and this overdose epidemic problem. What do you see for the future of healthcare?
Yes, my background has been in public health and specifically sexual health as well. So I spend a lot of my time also addressing things like HIV, sexually transmitted infections. I'm optimistic. I'm optimistic. You know, we have seen in 2023, we saw a first decline after many years in fatal overdoses. And likewise, we're starting to see some decline in STIs, and over the last decade, we've seen pretty significant declines in HIV. And that's one thing I really love about Rhode Island. I do feel like we work together in this state. I feel like that there's a lot of great people, great organizations. Everyone's a phone call away. And I love the collaboration, the fact that we're all working together to some of these greater outcomes.
Why do you think that most of this stuff is on the decline? Is it because of education? Is it because of more information? What do you think?
Well, as you know, I think the cause of a lot of these things are highly complex, right? And I think that we're seeing some, hopefully we're seeing some of our efforts in public health paying off. I mean, how long have we been working in addressing the opioid epidemic? Same thing for STIs, HIV, things like that. I do think that there's a couple really significant things that are not being addressed in Rhode Island, as well as across the country. Things like mental health. We need to do a better job, improve access. Things like chronic disease, things like weight gain and weight issues as well.
Yeah, I mean, a lot of times too, and I see this a lot, diabetes. I mean, I'm a diabetic myself, but it came through the family. You know, I was the lucky guy in the drawer with, my siblings to get it. None of them else have it, but I have it. But I think that, more and more information and more education, whether it be substance use, mental health, diabetes, heart disease, it needs to start at a younger age. It shouldn't be when we're adults. It should be brought into the schools. We need a better control of our health classes and letting these kids know, because you drink Coca-Cola all the time or dark soda all the time, it could lead to X. I think we need to do more about that. And I want to talk a little bit more about that when we come back. You're watching Recovery TV, and I'm your host, John Tassoni, here with Dr. Chang from the Department of Health. We'll be right back after these messages.
And now, back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Dr. Chang from the Department of Health is in the house today. We're talking about substance use, mental health, COVID. We're talking about them all. And it's such a young gentleman right here taking on the bulls by the horns. So thank you, doctor, for what you do. We need a lot more younger docs to stay in Rhode Island instead of leaving Rhode Island and bailing out, because primary care right now is very, very important.
Huge issue.
Yep. So let me ask you this question. Someone of your stature now, you've seen how Rhode Island operates. You see the healthcare systems in shaky grounds right now. What's your thought?
Well, I still remain optimistic. I mean, I trained here, residency and fellowship at Brown, and I mean, I stayed because I loved it. I love my colleagues. I do believe in the systems here. I do see a lot of optimism. I do think that we need a game plan. We need a framework for how to approach this. We'll probably need some funding and resources. But again, I've really loved staying here in Rhode Island, and I think we have all the tools to make this happen.
Funding and resources in which way? To keep the docs here, maybe pay some of their schooling, stuff like that?
I mean, personally, a couple things. First off, I would really love to see a medical school at URI, a state-funded medical school. I think if we could make that happen, that would be a huge boon. We also need to incentivize folks to stay, and specifically physicians to stay for primary care. And we need to pay more, and this is a part of a bigger issue, but a lot of docs make much less money than in Massachusetts and Connecticut.
Department of Health, you said you wanted to say something about your colleagues at Department of Health?
I just want to thank all my colleagues at the Department of Health, a bunch of wonderful, selfless folks that really fight the good fight every day. So thank you to all of our health department staff that are listening.
Thank you for joining us today. It's really a pleasure to have you on. We'll have to have you back.
Thank you for having me.
My guest next week is Linda Hurley from Kodak. If you see something, say something. Have a great week.